Hello.
Hi, doctor.
Hi, good afternoon. My name is Omar. I'm one of the doctors from the GP here. I'm speaking to Oliver's mom.
Yes, my name's Sarah Thompson.
Hi, Sarah. Hi, nice to meet you, or nice to talk to you. How can I help you, Sarah, today?
I'm just calling about my son, Oliver. He keeps getting this infection like over and over again. I think he's had it like 4 times now in the past few months. And we've been using the cream that has been prescribed for him since the first time, but I don't think it's working anymore, and I'm just getting really worried now because it keeps happening over again.
All right, all right. I can hear has been frustrating for you and for Oliver as well.
Yeah.
Uh, let's go through everything carefully so we can figure out the best ways that we can help Oliver. Can you please tell me more what is like happening over the last few days?
So it's just like the same thing that's happened before. So his penis has just gone really red, and he complains of pain. So I'm assuming it's a bit sore as well. I've also noticed some white discharge, as well. And he's also complained of sting during wee. I've honestly tried my best since the first time that he's got it. So I've given him such like a strict hygiene ever since the first time, as the nurse told us to. But it doesn't seem like it's doing anything because it keeps coming back.
All right, that sounds uncomfortable for him.
Mm.
Have you noticed any other symptoms at all?
No, not really. Nothing more than that.
Like no fever?
No fever.
And has he been shivery at all?
No, he hasn't.
All right. And you mentioned about discharge. Can you tell me what is the color of the discharge, please?
It's just like some white discharge.
A white discharge, thank you. All right. And did he mention there is any blood in his wee?
No, and I've checked as well. There's nothing there.
All right, good. And did he complain of any vomiting, any stomach aches?
No, none of that.
All right. Any diarrhea at all?
No.
All right, that's really good. And you mentioned that you have been following strict hygiene advice. Can you please tell me exactly what you have been doing?
Yeah, so I've just been making sure that it's just like little things. I've just been making sure that he washes his penis like thoroughly with just warm water. I've told him to not use any sort of like soaps or fragrant like shower gels or anything that have sort of like fragrance in it that might irritate a bit more. I make sure that he also dries himself properly before he puts his underwear on. I also make sure his underwear is cotton and not too tight to make it, as comfortable as possible. And I make sure that he also changes it daily. I obviously check with him with all these things.
All right, that sounds good. Well done for that, and keep it up, please. Just to confirm with you, Sarah, is Oliver is circumcised or no?
He's uncircumcised.
Uncircumcised. All right, thank you. And did he mention there is any difficulty in retracting his foreskin back?
A little bit, actually. He says that sometimes it feels like tight, I think, and a bit sore.
Hmm. Mhm. I see. Thank you. And given like he's having this kind of repeated infections over the last few months, and you mentioned it is the first time today, uh,
Mhm.
did you think about it? Like, do you have any thoughts in your mind what could be causing it?
I don't really know. Like I don't actually know what it could be. I just know it's not normal for this to keep happening over and over again.
Yeah, I would agree with you, Sarah, in that. Have
Mhm.
you noticed any other like recurrent infections anywhere else? For example,
No, I haven't.
all right, no cough, no common cold.
No.
All right, okay, thank you. Have you noticed he has been drinking water more than usual or feeling very thirsty?
Yeah, actually, I have noticed that. Yeah, recently.
All right, and when you say recently, over how long?
I'd say around like 6 months.
All right, 6 months. Okay. And have you noticed he's weeing more than usual?
Yes, actually, I have noticed that. I think he wees like every 1 to 2 hours now,
All
and
right.
it even gets to the point where he wakes up in the middle of the night to go. So even at night, that doesn't stop him. He still goes at night, he wakes up just to go for a wee.
All right. Does he wet himself at night?
No, thankfully not.
All right. Okay. And have you noticed any weight loss at all?
Um, Now that you mentioned it, actually, yeah, think I have. I think he lost maybe like a stone or so over the last 5 months. But he's got a good diet. Like I make sure that he's got a well balanced diet, so I don't really know why that is.
All right, thank you too much. So he lost 1 stone over last few months' time. Okay.
Yeah, around 5 months.
All right. And may I ask you, any family history of any diabetes at all?
No.
All right. Okay. Thank you for that. And can I ask you, where is Oliver at the moment?
He's at school.
At school. All right. Okay. And can I ask you just a few questions about the home situation? Who lives at home?
Yeah, so it's just me, Oliver, and his dad.
No other kids at home.
No.
All right. And may I ask about your work as well? Do you work? Sarah?
Yes. I both me and his dad work full time. I work in Asda, and his dad's an accountant.
All right. Good. Any stress at all at home?
No, not really.
And both of you guys are coping well with Oliver. I know having like unwell child at home sometimes.
Yeah, we've both been managing fine. It's just sort of irritating that it just keeps coming back and back, and we're both just worried because we don't know what it could be since it keeps coming back.
All right, amazing. And is there anything in specific worrying you about Oliver?
Yeah, so I'm just worried that it's something serious, maybe something with like his immune system, or maybe even something worse that we've not thought about.
Okay, I think that makes sense. And if I'm in your place, I think I will start worrying if I have my kid having recurrent infections. And are you hoping for something I can do for you today?
Yeah, I would just like to get a stronger cream if that's all right. Like one, because I feel like the one that we've got just doesn't work and it doesn't help, and I want something that will actually work this time and stop it from coming back.
All right. Yeah, I can imagine where are your concerns coming from, especially this is the first time. Well, Sarah, thank you for coming today and raising all of that with us and telling me all of this valuable information. I would agree with you, Sarah, in terms of like worrying about what could be triggering his recurrent infections, especially this is the first time. And you have been doing an amazing job. You told me you have been like following strict hygiene, no tight clothes, all of that. And you gave him the treatment before and it cleared up coming back again.
Yeah.
I think it makes sense, Sarah, to see Oliver today as urgent face-to-face. And the reason I'm telling you why urgent face-to-face, because telling me that he lost some weight and weighing more than usual, feeling thirsty. If I put everything together, Sarah, that can tell me there is a possibility, I'm afraid, that he might have diabetes.
Oh, diabetes. I wasn't expecting that at all, really.
I completely understand. And I know hearing the word diabetes itself might sound worrying, but I don't want to rush into conclusions. It is just about possibilities, and we need to make sure he doesn't have diabetes, because if he does and we catch it early, the earlier we catch it, the earlier we start treating it, the better is the outcome on the long term. So I'm happy you came today raising all of that, because if as I mentioned, diabetes, if we catch it early, we can start treating straight away.
Yeah, I see. I just wasn't expecting it, but I agree with you. I guess it's better to check now rather than ignore it.
Yeah, well done for that. Thank you. I think if you can like bring him after the school time, probably around 4 o'clock, if that is convenient for you.
Yeah, that sounds perfect. Yeah.
Right. So what I will do with him, Sarah, when he comes here today, I will examine him. Definitely will examine his foreskin to see if there is anything, how is the inflammation, and for this infection, we call it Balanitis. I don't know if you know the name Balanitis, or one of my colleagues did mention that before to you or no.
Yeah, I have heard that before, yeah.
All right. So if it is, which I assume it is, given you are telling me the same symptoms, we can give him actually, and you mentioned about also you want stronger, probably some cream for that. We can give him a combination of cream, which has antifungal and some mild steroid. It ease his discomfort and inflammation, and it will help with the current infection as well.
Yeah.
Okay. What do you think?
Yeah, I'm happy with that. I think that's good.
All right, thank you. Moving forward, Sarah, because I mentioned and I'm sharing with you my thoughts and my concerns, just to make sure we are not missing anything and we are treating the actual disease rather than treating the symptoms of having recurrent infection.
Yeah.
I need to check his weight today, because you mentioned about he lost some weight. I need to examine his body, listen to his chest. Also, I need to check his urine, because if the urine shows sugars. So that will raise our suspicion as well.
So what happens if you find sugar in his urine?
All right, that's a good question, Sarah. Usually, we check the urine to check if there's any, for example, any high sugar. There's something else called ketones. You don't need to know about the name, but ketones and sugar, if we find both of them high, so that it is suspicious about having what we call it type 1 diabetes or diabetes. I will also do a, yes, please go ahead.
Yeah, no, yeah.
Right. I will also do a quick blood test from just the finger, just a very tiny 1 drop or 2 drops of blood, just to check his blood sugar as well to see if he's having high blood sugar or no.
Okay. Yeah. Yeah, I'm happy with that. Yeah. I just if we do find out that he does have diabetes, what's gonna happen?
Well, if I do have, as I mentioned, like high sugar level in his urine and his blood, we need to send him to the hospital straight away today to be seen by the pediatric team same day.
Oh, right, to the hospital. Okay.
Are you free to take him or his dad?
Yeah, I'm free to take him today. I'm off work this week, so yeah, I'm happy.
All right, that's really good. And just to make sure, don't worry about having, even on the worst case scenario, if you will have diabetes, not the end, because as I mentioned, the earlier that we treat him, the better is the outcome. And we'll follow up with you on a regular basis to make sure everything is sorted and you have all the support.
Okay, yeah, that's really reassuring, doctor. Thank you.
All right, perfect. So I will see you both then in the afternoon. But just in case, Sarah, just in case if you start vomiting, drowsy, getting very unwell, take him straight away to NE and let me know. Otherwise, I will check him over this afternoon.
Okay, yeah, will do. Right, perfect. See you later.
Right, see you later today.
Thank
you.
Bye.
All right, thank you for the repair. Thank you. Guys, yes. Any questions, guys? So it is just a very common case. Balanitis is a very common case. And why we thought to bring up balanitis in a very totally different case scenario in kids, because yes, balanitis can be in kids, can be in adults, can be in like 1 year old boys, can be in different ways. Can come with diabetes, and this is the first presentation. Don't forget it can come with STI. Don't forget if someone, and I should ask this, but because the time was moving, I didn't ask. If you have time in the exam, you need to ask about any recent antibiotic. I was marking this, but I didn't have time. And again, it's not the end if you miss 1 or 2 questions, and if there is no any steroid course recently, especially if your patient is asthmatic or COPD, you need to ask about steroids and recent antibiotic for asthma flare-up or COPD flare-up. Guys, feel free to ask and comment. Anything you would like to add?
Well done. Very nice. We learned a lot how to do as a ideal consultation. Thank you.
Any questions, guys, or anyone else would like to run through the management? If you suspect type 1 diabetes, hospital straight away. Okay? If you suspect or you find your patient is having type 1 diabetes, especially in kids, hospital straight away, they need to be seen by same day.
Hi, Amar. Yeah, thank you. It's really a good case. But going forward, if it's not like say a glucose in the urine, are you going to do any investigations?
Yes, he will need investigation. And why? He lost 1 stone. And this patient will need bloods and referral to pediatric team. Okay, so this patient, if he doesn't have diabetes, he lost 1 stone and he's eating well. So even if he doesn't have any glucosuria or any ketones, again, he needs further investigations to see why he's losing his weight.
Sorry, is that urgent referral, same day?
For diabetes?
No, for the loss of weight.
Loss of weight, it depends. It depends. Okay, if there's any other features, for example, if you suspect any enlarged lymph node or something, usually you can discuss with the Kuala or pediatric team. Usually, in reality, you can discuss with the pediatric team and tell them, can you see the patient today or tomorrow?
Okay.
Okay.
Dr. Amar, quickly, just wanted to ask you about other causes of balanitis in children besides diabetes, recurrent balanitis
Yes.
in children.
Any
what should we think?
immunocompromised. Yeah, any immunocompromised can be any bad hygiene. That's why I asked here about hygiene as well. So any bad hygiene, it can also triggering for her. Any repeated trauma, any new shower gel or any new soaps, which I should ask about this, but I didn't ask. Again, could be. If she started to use any shower gel, new chemicals, it could be. But because she gave me the history or clue of diabetes, so I had to ask about diabetes in more details and other symptoms as well.
Thank you.
Hello?
Yes, Dr. Ahmad Rafi.
Yeah, hi. I understand your rationale of bringing the baby and examining him for diabetes, because you asked all the question and it seems like he's having diabetes. And I understand again that you wanted to make a plan as like, this is a diabetes and you will want to, exclude that as an underlying cause of repeated infection or balanitis. But you didn't give the other possibility, which is that if he doesn't have diabetes, what is your plan?
Yes.
So there's a possibility here there's a diabetes. Maybe I understand highly likely it's a diabetes, underlying diabetes of the cause, but you don't mention to the mother in case of that we don't have diabetes, what is the next step?
Mm-hmm. Yes, and this is what Mukhtar mentioned now. Yes, if it is not diabetes, I should mention we still investigate and refer because he lost one stone. Plus recurrent infection. If we didn't find any triggers, we need to also refer to find out why he's having recurrent infections. Yes, I agree. And if there is no any weight loss and only recurrent balanitis, he's uncircumcised, we might also consider referring later for urology team, pediatric urology, just to for circumcision or surgical team for circumcision. I agree. Yeah, this point is very important. Yes. Yes, Dr. Noor Jasmine.
My question has been answered. Thank you.
All right, thank you. Dr. Kabir. Yes, Kabir.
Thanks, Amar. So, Amar, I was just wondering, can this case of recurrent balanitis, instead of being a diabetic theme, can this case come as a safeguarding theme, like just a pure safeguarding case? Can this theme be brought up?
Could be.
Okay, and in that case, would that be like a child is being neglected? Will that
It could be also sexual abuse? So we need to ask. Yeah, we need to ask about this as well. Because I found out it is diabetes, so I went for that.
Yeah, exactly.
But if you can't find any diabetes or something, you need to continue asking. And one of the questions, do you have any concern about he's involved in sexual intercourse or any sexual abuse or exploitation? Did any change in behavior? And did the school mention that or raised any concern about that? Yes, definitely. If there is no any diabetes symptoms, yes, we need to continue ruling out other stuff, including any possibility of safeguard.
Right. Thank you.
I definitely agree. Safeguard, if there is no any other underlying factors, we need to rule out safeguard for kids.